Well, welcome, and this video is for people that want to get a basic understanding of the nature of infection and immunity. Now, first of all, what do we mean by this term infection? Well, infection means the presence of microorganisms in the tissues of the body. So normally the tissues of the body are supposed to be sterile, absolutely no bacteria, no viral particles at all, just completely sterile. But in infection, that situation has changed and there are microorganisms in the tissues of the body. That's what we mean by infection. Now, an infectious disease is also called a transmissible disease. So some diseases are not infectious, they're not transmissible, you don't catch them from someone else, you don't pass them on to someone else. So for example, some diseases are degenerative in nature. Other diseases are inflammatory in nature. But infectious diseases are transmissible. They're passed on from one person to another via an infectious, infecting agent. And an organism is anything that's alive. So the organism is something which is causing the disease. It's a causative organism. Now, this term organism is not limited to that. So I'm an organism, you're an organism, a dog is an organism, an amoeba is an organism. But we talk about the organism as a type of bacteria, a simple organism called a bacteria, so-called prokaryotic organisms, simple organisms. And when we talk about organism here, we normally include viral particles as well, although we could spend several videos debating whether viral particles are alive or not. Now, very often in healthcare we talk about bugs. So if someone will have a chest infection and I'll say, well, what bug is it? Which of course is appalling shorthand, but we use it quite a lot. It means what is the causative organism? What is the organism that has caused this? But we tend to talk about bugs. There you go. It's just what we do. Now, the host is the person that is hosting the organism. So if you come to my house for tea and stay the night, I will host you. I will be your host. You will be my guest. And it's the same in this situation here. The host is the person that has the infection. So if a bacteria comes into my body, I am that bacterial host. Just the term we use. The presence of infection will cause clinical features. Now, clinical features is anything that we can recognise that will help us to identify if someone has a disease state. And clinical features can be signs or symptoms. A sign is something that I, as an examining person, can see. So a sign could be a swelling, or it could be a smell, or it could be something that I palpate, something that I feel. So that is a clinical sign. Or if I take your temperature, that is a clinical sign, or record your blood pressure, or take your heart rate, they're clinical signs. But symptoms are things you report to me. So if you say, John, I feel absolutely awful, that is a symptom. If you say, I've got a headache, that is a symptom. If you say, I'm feeling anxious, that is a symptom. So we take together signs and symptoms to collect together a clinical picture of the particular condition that someone is suffering from. Now, with infectious diseases, people can suffer from the disease if they're infected, but others will have the organism in their body and be carrying it to other people, but not suffer from the disease themselves. And such people are called carriers. So a carrier can carry the infection from someone else to me or to you and normally not suffer from it themselves. They are carriers. And very often carriers are described as being asymptomatic. They are without symptoms, but they can infect other people. Children, for example, often carry influenza back home to their parents. They act as carriers. Now, immunity is the ability of the body to resist infection. And there's two types of immunity. Immunity can be innate or it can be acquired. Now, immunity that is innate I have by virtue of the fact of my normal anatomy and physiology. So innate immunity is my intact skin, my intact mucous membranes in my mouth, the cilia wafting up the hairs in my respiratory tract, the mucus lining my gastrointestinal tract. All these things are innate immunity. But if I'm exposed to a particular organism, then I will, because I'm exposed to the organism, I can develop specific immunity to it, but it's acquired. I have to be exposed to the organism first, and then my body will make particular immune proteins to give me that level of immunity. So first I'm exposed to the organism, then I develop the acquired immunity. And the acquired immunity is specific to the particular organism. So if I have the organism, the measles virus, that won't make me immune to the tuberculosis bacterial infection. It is specific. And if I have the measles virus, I won't be immune to a cold virus, a rhinovirus, or I won't be immune to a poliomyelitis virus or any other virus that you care to mention. It's specific to a particular causative agent, the specific immunity that is acquired. Whereas the innate immunity is more specific. It works against a wide variety of potential infecting agents. Now, the probability of exposure leading to infection. Now, there's 3 factors here. So if I'm exposed to an organism, how likely is it I'm going to start suffering from an infection? Well, that depends on the virulence of the organism. And virulence means the ability of the particular organism, the particular bug, to cause disease. And virulence can also infect the infectivity of the organism as well. So a virulent organism will be easy to transmit, and it will cause a lot of disease when it gets into you or me. It's a virulent organism. It's not benign, it's virulent, aggressive, can cause a lot of disease. So that's one factor. And the second factor is the number of organisms. So normally you'll need quite a lot of bacteria to cause a bacterial infection. Although with some very transmissible bacteria, just maybe half a dozen or a dozen bacteria might be enough to start triggering off an infection. So the more organisms you're exposed to, the more likely you are to get the infection. So if you're exposed to a virulent organism and a larger number of virulent organisms, you're much more likely to get a particular infection. And the third factor depends on your immune defences. So are your innate immune defences intact? So for example, if people have sexually transmitted diseases that damage the genital mucosa, then they're more prone to getting HIV virus, human immunodeficiency virus, the HI virus. So anything that interferes with the natural innate immunity can lead to immunodeficiency. Or if people smoke, that can paralyse their cilia, making them more prone to bacterial chest infections. Also, there is specific immunity factors. So, for example, if you've been exposed to the organism before, then you're going to have immunity to that organism and hopefully not get it. So they're the 3 factors that determine whether you're going to get an infection: the virulence of the organism, the number of organisms that get into you, and your immune defences. They're the 3 factors. Now, humans and bacteria. It's often said there's more bacterial cells in and on us than comprise the human body, and that's true. Because most bacterial cells are only about a micrometre in diameter, whereas most of your cells are 6, 7 or 8 micrometres in diameter. So bacterial cells are much, much smaller. And there's bacteria all over the skin, there's bacteria in the mouth. Now, we know this in A&E departments because human bites are very dirty and always getting infected. There's bacteria in the vagina, there's bacteria throughout the gastrointestinal tract. But there's none in the tissues of the body. The internal tissues are completely sterile. They have no bacteria whatsoever. They are completely sterile. 0 bacteria, 0 viruses. There are no bugs in the internal tissues of the body. Now, it's interesting to think about the relationships that we have with these bacteria, because bacteria cover all the surface of our planet, from way down in the earth to way up in the air. You can't go anywhere on the surface of this earth without bacteria. So these relationships can be described as commensalism with commensal organisms, mutualism with mutual organisms, or parasitic with parasitic organisms. Now, first of all, commensals. Commensal organisms, or commensalism. Organisms which live with us but normally cause no harm. The commensal flora. So there's commensal flora all over my skin surface. None of my skin surface is sterile. In the mucous membranes, there's commensal flora. All throughout my gastrointestinal tract, there's commensal flora, especially in the lower parts of the gastrointestinal tract, such as the colon, full of commensal flora. So we live with them, they live with us, no big deal. It's just the way it is. We're covered in these organisms. Now, mutualism is mutual bacteria derive benefit. So the bacteria derive benefit from us, and we derive benefit from them. It's good that we have these, so they derive benefit from us and we from them. So, for example, coliforms coli is the colon. So these are bacteria that live in the colon. Now, these bacteria like a nice place to live, so they just love living in your colon. It's warm, they have a regular food supply, they have fluid supplies. It's great for them. But they produce some vitamin K for us, which is then absorbed into the lower part of the colon. So mutualism is a win-win situation. We provide them with somewhere to live, they provide us with a service. So, for example, if we take antibiotics that kill some of these mutual bacteria in the colon, because the antibiotics kill them, they can give us diarrhea, because we've got rid of these natural bacteria. And there's a risk that if we kill off these natural bacteria, then they'll be invaded by some deleterious organism, such as a fungal infection, which may cause something like irritable bowel syndrome, which can be caused by fungal infections on some occasions. So these are good. So they're neither good nor bad. They're good for us, good for them. But the last one is parasitic relationships. And in parasitic relationships, like if you've got worms in your stomach or bacteria living off you somewhere, then the infecting organism gets a benefit to your detriment, to the host detriment. But a lot of organisms haven't evolved to kill us, because then they will be killing their host, which would be bad for them. So sometimes they just make us very sick for long periods of time, because they're quite clever, really. But parasitic means that they are getting benefit from us, and we are having an adverse effect as a result of their living in or on us. So that's commensalism, mutualism, or parasitism are the three types of relationship. Now, pathogenic microorganisms. Path means disease, genic means beginning, micro means small, organisms mean a living thing. So these are pathogenic microorganisms. These are microorganisms, and we normally include viral particles in this. Bacteria or viruses usually that cause disease. They are disease causing. Genic, the beginning of disease. They cause disease. So bacteria, viruses which cause disease if present. But commensal organisms can become pathogenic opportunistically. They can be opportunistic pathogens. For example, E. coli might be commensal in the colon, but if it gets into the urethra and ascends up into the bladder, it will cause cystitis. If it ascends up into the kidneys, it will cause pyelonephritis. So it's quite harmless if it's in the colon where it's supposed to be, but if it gets where it's not supposed to be, then it can cause infection in an opportunistic way. So commensals can become opportunistic pathogens, whereas these organisms are always pathogens. They will cause disease if present anywhere, but these will cause disease only if they are in the wrong place. So opportunistic microorganisms. Now, these are different organisms, different bugs, that are often of low pathogenicity. That means they're not strong pathogens like these. They have the potential to cause some disease, but not strongly. They're not virulently pathogenic. They're only mild. They only have mild virulence, mild pathogenicity, but may cause infections in certain circumstances. And these infections are usually when the reduced host defences are present. So another classic example here is any time you have an immunodeficiency syndrome for whatever reason. So for example, you could have human immunodeficiency syndrome, or you could have a leukopenia, a lack of white blood cells, or a neutropenia, a lack of neutrophils in your blood. And that would mean that your host defences were down, and then organisms which were not normally pathogenic could become pathogenic. People with HIV, for example, get cryptococcal meningitis, which is very uncommon in non-immunosuppressed patients. But it takes the opportunity, the organism takes the opportunity to cause an infection if the host defences are reduced. Now, local and systemic infections. Now, local infections are just that. They are local to one part of the body. They do not spread around the whole body. And these local infections normally cause inflammation. And we recognise inflammation because there's heat, pain, redness, swelling, and very often loss of function. That's how we recognise inflammation. So, for example, conjunctivitis is inflammation of the conjunctiva in the eye. Boils are inflammation of hair follicles with infection. Abscesses are collections of pus, which the body has consolidated. And pus is normally dead and dying bacteria with dead and dying white blood cells. Pus in an abscess. Osteomyelitis would be infection in a bone, which can be very difficult to get rid of. Cellulitis would be infection that spreads in the subcutaneous tissues of the body. And balanitis is infection of the glans, penis in men. So they can be local infections, but there can also be systemic infections. And systemic means that all the systems of the body are infected. There's an overall body disease. So what very often happens here, there's bacteria that cause inflammation, say in the lungs or in the gastrointestinal tract or wherever there's an infection, and these release toxins, and this actually causes a systemic inflammatory response syndrome. So it's systemic, it's all over the body. So for example, that can raise the heart rate, it can raise the respiratory rate, it can raise the body temperature, it can raise the blood sugar levels. It will raise the level of white blood cells that are there to protect us against infection. So this means it's an all over thing, and with that normally we feel sick. We feel like we're ill. We're nauseated, we have malaise, general malaise. We feel ill, we don't want to get out of bed, we don't want to work. And in fact it's quite important that we do rest when we have a systemic infection. And systemic infections can be caused by bacteria, sometimes by fungi, and very commonly by viruses. So for example, if we have an influenza virus, we're going to feel absolutely awful because we've got the flu. All over we feel awful. We have achy joints, achy muscles, fever, headache. It's a systemic infection. And then just to finish this first part of the introduction, there's quite a bit of donkey work to do if you want to understand this, I'm afraid. We're going to look at what we mean by epidemiology. Now, epidemiology is the causes, incidence, distribution and control of disease. That's what we mean by epidemiology. So the cause of disease is sometimes called etiology. The incidence of a disease is how many new cases of the disease we get, and the geographical distribution of the disease, if we understand where it is, if the disease is present in one town or not in another town, or in one country but not in another country, or it's present in one population but not another population, that can tell us all sorts of things about the causes and distribution of that disease. So just to take one example, breast cancer is relatively common in people living in the United States and the United Kingdom. Breast cancer is relatively uncommon in women living in Japan. Why is there this difference? Is it a dietary factor? Is it related to dietary fats? So once this difference has been identified, we can start to look for reasons why this difference is there. And this of course leads to lots of fascinating studies, because we can start to work out the causes of disease. And of course, if we can work out the causes of disease, we can work out how to treat it. So smoking was found, lung cancer was found to be more common in people that smoked than people that didn't smoke. That indicated that the cause of lung cancer very often was smoking cigarettes. This is the sort of thing that epidemiology can tell us. But relating specifically to infectious disease, a disease which is endemic is always in the population and people can catch it all the time. So the common cold, for example, is endemic. We're always getting colds. They never go away. It's an endemic condition. In many countries in Africa, malaria is always there. It's endemic. It never goes away. It's always present and cases are always cropping up. It's an endemic disease. But an epidemic is a sudden increase in the incidence of new cases of a disease. So in 1918-19 there was a localized epidemic of influenza in the United States, and there was a great increase in the cases. But then that spread around the world to become a pandemic. So an epidemic is a relatively localized increase in the incidence of a disease, where a pandemic you get an increase in the incidence of disease, but cases start popping up all over the place. And normally when we say a pandemic, we mean it's on 2 or more continents, although there's no fixed definition of this. But that's normally what we mean. And also normally with an infectious disease pandemic, it's going to be spreading from person to person in the community. So HIV was a pandemic, still is a pandemic. It's a pandemic of disease that spreads all around the world. Now, mortality rate is how many people die in a population per year. So we could take the overall mortality rate in my city and state it that it was so many people per 1,000 per year. Or we could talk about the mortality rate for a particular condition, although there it's usually more accurate to talk about case fatality rate. But mortality rate basically means the number of people that are dying in a particular population, normally per 1,000 of the population, per year, the overall crude mortality rate. Morbidity means disease. So mortality means death. Morbidity means disease. So morbidity means how much disease there is in a population. How many people are sick today would be cross-sectional morbidity data. Or we could ask how many people were sick over the course of a year, and that would give us morbidity data. Now, when we're talking about in disease, particularly infectious disease, but not necessarily infectious disease, we can talk about incidence and we can talk about prevalence. Now, incidence is the number of new cases in a particular period of time. How many new cases are there? Prevalence is how many cases are there in the population at a particular point in time. So if we take a disease like multiple sclerosis, which fortunately is relatively uncommon, therefore the incidence of that is fairly low. But once someone has that disease, they're likely to live with it for 40 years. So the incidence is going to be relatively low, but the prevalence is going to be much higher. The number of people getting the disease in any one year is going to be much lower than the number of people we have accumulated with the disease. Whereas with acute disease, normally we expect the incidence to be higher than the prevalence. So how many people have had coryzal infections, a common cold, this year as a result of rhinoviruses? Well, I probably had 2 or 3. So that's got a relatively high incidence. But if we ask how many people have a common cold today in the city, that's going to be much lower. The prevalence is going to be lower than the incidence. So chronic diseases normally have a lower incidence and a higher prevalence. Acute diseases normally have a higher incidence and a lower prevalence. Now, that was quite a lot of information to try and assimilate. You can go back through it again. I will be posting all these notes in the description of the video, so you can see them, you can download them, you can print them out, make your own notes. But when we start to learn a new subject like infectious disease, and when we think about infection, immunity and epidemiology, these are some of the basic terms that we need to learn to allow us to read more detailed texts and understand more detailed information on this subject. That's some of the building blocks that you're going to need as you develop your skills and knowledge in this area of fascinating study.